Welcome back to the Medigap Show. I'm Holly Cohen, your dedicated guide and licensed agent through the intricate world of Medicare. Today, we're discussing the seismic shifts occurring across the Medicare landscape. Hospitals are leaving Medicare Advantage Plan networks in droves. Also, marketing tactics are evolving, and the government is demanding transparency about Medicare Advantage plans. This is a crucial exploration. Settle in and let's unravel the complexities of Medicare together. Don't forget to subscribe for more insightful Medicare updates. We begin with a nationwide exodus. Hospitals are leaving Medicare Advantage Plan networks in droves, a ripple effect that directly impacts the choices available to seniors. So let's go through the evidence from news articles and some news videos across the country, highlighting the financial challenges, contractual disputes, and the resulting impact on Medicare beneficiaries. Hospitals are leaving Medicare Advantage Plan networks in droves across the country. Here's one example. We'll get into a few others, so stay close. But let's listen to this story right now. This is from my hometown of Louisville, Kentucky, the Baptist Health Hospital Network.
Health insurance dispute could leave patients in Louisville paying more.
Baptist Health is at odds with United Healthcare, the nation's biggest insurer. United is warning its AARP Medicare Advantage members they will lose access to the Baptist Health hospitals and doctors on January 1st. Meanwhile, Humana Medicare Advantage members have not had access to Baptist's network of doctors for nearly 2 weeks in a separate dispute. Medicare Advantage is an option for seniors to get their government-funded health care through insurance companies like Humana and United, but the extra benefits these plans offer come with trade-offs.
Almost every doctor, almost every hospital in the country takes traditional Medicare. But once you enroll in a Medicare Advantage plan, it's entirely different. They are private plans operated by private insurance companies, and for the most part, gigantic insurance companies that are under relentless pressure from Wall Street to make as much money as possible.
That was Wendell Potter. He is a huge advocate he used to work for some of the major carriers in their marketing departments, and he understands that the way our Medicare Advantage programs or plans are structured are that when you go on to a Medicare Advantage plan, it takes you off of original Medicare, which means you are then completely in the hands of an insurance company that is a publicly traded insurance company, a for-profit insurance company that's publicly traded on Wall Street with investors, and their fiduciary responsibility, first and foremost, is always to their stockholders before even their policy owners. So that's just how the financial responsibility falls when you're a publicly traded company. Now we're going to talk about another dispute that just happened 2 days ago, where Baptist Health and another large insurance company end agreement. Which means a lot of people that are covered under this particular insurance company's Medicare Advantage plan may no longer be able to visit their trusted doctors and their hospitals. So let's watch as this local news channel breaks this story.
Huge healthcare providers arguing with huge healthcare payers. On New Year's Day, that kind of fight left a huge number of Arkansans looking for new doctors.
Baptist Health is no longer among the network providers for United Healthcare. THV 11's Brooke Buckner shows us how it's affecting patients caught in the middle.
I'm not really sure yet what it is we're going to do if they don't figure this out quickly.
Kate Bush hopes this is all just temporary, but right now she and many Arkansans aren't covered by United Healthcare at Baptist. She found this out Tuesday at her appointment.
They just informed me that I might have to just pay for it out of pocket and let me know that at the time, and it's like, well, I don't really have much of a choice at this point.
Right now, Bush and her husband still plan to go to their scheduled appointments because they're high priority.
When you've got medications that not only help your quality of life, but in some cases help keep you alive, that's a problem to have to start over.
She says she might have to explore options elsewhere to get doctors in network, but before that, she plans to reach out to United to see if she's able to get continuation of care.
So now let's take a deeper look into the evolution of Medicare Advantage Plan marketing tactics in recent years. Marketing dollars have poured in, enticing Medicare beneficiaries to enroll in Medicare Advantage plans, featuring commercials with famous personalities making enticing promises of extra benefits. But how accurate are these claims? Let's delve into connecting the dots between marketing dollars, misleading commercials, and the decisions that seniors make about their Medicare choices. The allure of extra benefits has become a powerful tool in convincing seniors to switch to Medicare Advantage plans. It's crucial to decipher the truth behind these claims and recognize the impact that they have on decision making. We are going to listen in on a recent Senate Finance Committee hearing about Medicare Advantage plans and deceptive marketing.
So this week, millions of people will begin the process of choosing a Medicare plan through open enrollment. And one option is to stay with traditional Medicare. The other is to enroll in one of the many Medicare Advantage plans, or MA, as people often refer to it, which allows these for-profit health insurance companies to offer Medicare coverage. Now, in theory, these private companies should compete on the merits of the coverage they offer. Instead, big MA insurers with a war chest of advertising money use deceptive marketing tactics to lure seniors into the wrong plans. These companies exaggerate benefits. They claim that seniors can keep seeing doctors that are actually out of network, and they deceive seniors about how much they'll spend for out-of-pocket care. This is harmful to seniors, and that's a big part of what this hearing today has been all about.
The evolving marketing landscape requires vigilance in understanding the real benefits and limitations of these Medicare Advantage plans. The government is taking action to demand transparency from Medicare Advantage plan insurance carriers. Proposed legislation and government statements underscore the imperative need for clarity. Senators are leading the charge for transparency among Medicare Advantage plans. Their efforts align with the need to curb these misleading practices and ensure that seniors can trust the information that they receive about their Medicare options. Now we're going to discuss a bill that some of the U.S. senators have introduced as bipartisan legislation to increase transparency over Medicare Advantage healthcare plans. So let's dive into this article right now. U.S. Senators Warren, Cortez Masto, Cassidy Blackburn introduced bipartisan legislation to increase transparency over Medicare Advantage healthcare plans. From Washington, D.C., U.S. Senators Elizabeth Warren, Catherine Cortez Masto, Bill Cassidy, and Marsha Blackburn introduced a bipartisan legislation to improve transparency of Medicare Advantage plans and ensure if these plans are best serving the healthcare needs of America's seniors. The Encounter Data Enhancement Act would require Medicare Advantage plans to report important information about how they are actually paying for patient services and how much patients are responsible for paying out of pocket. In 2023, $454 billion, or 54% of total federal Medicare spending, went to Medicare Advantage, private insurance companies contracting with the federal government to provide Medicare coverage for over 30 million Americans. While the federal government already requires Medicare Advantage plans to report encountered data on services provided to beneficiaries, these records are often incomplete or lack key information that is essential to combat fraud and abuse. For years, Medicare Advantage plans have been using a long list of tricks to overcharge the government for coverage while delaying and denying care for seniors, said Senator Warren. By strengthening data transparency, this bipartisan bill will empower lawmakers and regulators to rein in this fraud and abuse and ensure taxpayer dollars are being used to deliver high-quality coverage for Medicare beneficiaries. American taxpayers are paying hundreds of billions of dollars for seniors to use Medicare Advantage plans, but the federal government still doesn't know how much these plans are paying for patient services and how much patients are being forced to pay out of pocket, said Senator Cortez Masto. My bipartisan legislation will ensure that these plans are transparent, helping us conduct appropriate oversight and provide seniors with the best possible care coverage. Just as price transparency is good for patients, data transparency is good for the federal taxpayer, said Dr. Cassidy. Specifically, transparency allows taxpayers to better understand how the hundreds of billions of dollars going for Medicare programs is being used and answering the question of if the money can be better used. As the preference for Medicare Advantage grows among seniors because it provides more robust benefits beyond traditional Medicare, it becomes essential to encourage transparency in participating plans, said Senator Blackburn. This legislation accomplishes that by working to foster greater clarity in the billing practices of Medicare Advantage organizations, cultivating a more competitive and robust Medicare Advantage market for the benefit of future generations. I will include a link to the text of this bill so you can read it and understand it and look at its history. Stick close to the channel. This is going to be a rocky year because it's an election year. So whenever there's an election year, there are always proposed changes within Medicare because unfortunately our healthcare system can be political in the United States. I appreciate you joining me today on Medigap Show. If you like what you've seen, go ahead and hit that subscribe button and turn on the bell notifications icon. This is the time of year that you are able, if you are in a Medicare Advantage plan, you're able from now until March 31st to disenroll from Medicare Advantage and go back to original Medicare. And by doing so, you also are allowed to enroll in a Medicare supplement, also called Medigap plan, which keeps you on the original Medicare, federal Medicare system, which allows you to go to any doctor, any hospital in the whole United States. And you have no prior authorizations with original Medicare. If your doctor deems something as medically necessary, it must be covered by original Medicare. Medicare Advantage plans are very different. As you've seen previously on this channel and in these videos that I exposed today, you understand that there's a huge difference between an insurance company that is standing between you and your original Medicare. When you're on Advantage plans, that's what's happening. A Medicare Advantage plan blocks your original Medicare. You come off of original Medicare and you go on to a Medicare Advantage insurance company plan. That's where the confusion always is. You can also always schedule an appointment with me or a licensed member of my team and go over your own Medicare situation. If you like what you've seen, be sure and give the video a thumbs up and let's continue this important conversation. Until next time, I'm Holly Cohen from the Medigap Show, committed to helping you make informed and empowered Medicare choices. Take care, and as always, be well.